A very big reason people are living here today is for the sole purpose of healing others in need.
We don't walk at it alone. It's a magnificent blend of individualistic people with extraordinary abilities, all joining in to heal the world together.
And since all of us have the ability to heal, there must be a way to tell the world all about it.
Welcome to the Healers Podcast. Today on The Healers, we were fortunate to sit down with Doctor of Chiropractic, Amin Javid, the brain and beautiful soul behind his brand, EVO of Beverly Hills. Dr. Javid is a biomechanical expert, his education coming under the famous Yale University and the College of Chiropractic in Bridgeport, Connecticut. Voted the top chiropractor of 2018 by Los Angeles Magazine, EVO of Beverly Hills is an award-winning healing center specializing in movement-related disorders, physical trauma, and stem cell therapy.
And welcome everybody to this episode of The Healers. My name is Logan. I have my host, the lovely Gabrielle, and we have our special guests today, Amin and Philip from EVO Beverly Hills. Welcome, guys, to The Healers show.
Thank you.
Thanks.
So nice to have you. We're very grateful and appreciative for you coming out, spending some time with us today.
We appreciate you having us on. Thank you.
Well, you're very welcome.
Very much,
Yeah.
We're so excited to talk about stem cells. This is the specialty for EVO, correct?
This is
Yes.
one of the core procedures that we do.
Fantastic. What type of stem cells do you do, and can you explain to everybody a little bit about them?
Yeah, definitely. I mean, stem cells is my passion, of course. This is something I've been involved in for over 20 years.
Wow.
The word stem cells is a little bit generic, so many people don't really understand what's behind that. There are many different kinds of stem cells, so you have to kind of narrow it down when you talk about stem cell therapy. You can take stem cells from body fat and you can break it down and remove stem cells from there. You can harvest stem cells from the bloodstream. You can harvest stem cells from the bone marrow. You can harvest stem cells from the skin. And there's also like embryonic stem cells that you can harvest. You can harvest them from placenta, from umbilical cord. So there's lots of different sources. And these stem cells are very different in their characteristics and the way they work. So of course you've got to know what kind you're using and what the application is. So for us at EVO, we mainly focus on fat-derived stem cells. So we can take some of the body fat through a little bit of liposuction. We can break that down, and that gives us two types of stem cells. We have what we call mesenchymal stem cells, and then we have hematopoietic stem cells, which are blood stem cells. And these have very different roles. So with mesenchymal stem cells, we can help to rebuild tissue, whereas the blood stem cells are more for kind of adapting the immune system and things like that. So they work very well together. And in some cases, we will use stem cells from an outside source. So we use maybe something called Wharton's jelly, which is basically from umbilical cord. It's mainly hyaluronic acid that's in there as a gel, but that also contains lots of stem cells. And we can inject those into joints, for example.
And why this type of stem cell versus others do you prefer to work with and use?
I prefer to work with the patient's own stem cells. With stem cells from the outside, we can kind of have an effect on like a temporary effect, let's say. We can help modulate things. But really, if you want a permanent effect, you need your own DNA. You need your own information too. But of course, sometimes through illness, through age, your stem cells can be weakened or damaged. So then it's important to take some information from the outside, but then combine it with your own stem cells as well. So that's why we try and work with both.
I see. And what type of injuries are you seeing? Are you treating at EVO that you're seeing great success with the stem cells?
Well, when it comes to injuries, actually, there's numerous injuries. We see a lot of inflammatory related injuries, chronic overuse injuries. We see a lot of rehab type patients who have neither an old fracture or ligamentous tear that didn't heal correctly and is therefore inhibiting correct joint motion. We see even everything from injuries to degeneration. This is kind of my role in EVO, is that, as a chiropractor, And as a chiropractor who's published work in human biomechanics, I'm very well versed in motion. And so I always first test the range of motion of the joint. And we kind of work from that moving forward to restoring range of motion. And usually once you can restore the range of motion, reduce the inflammation, and the role that stem cells play, usually the pain level significantly decreases and then the range of motion increases. Everything from the knees to the shoulders. So, we've had tremendous success with disc herniations, lumbar disc herniations, and cervical disc herniations. Wow. So they serve so many different roles that it's hard to say what specific injury, but they don't discriminate based on the injury, right? Stem cells are kind of indiscriminate cells that help heal. What we see a lot of are shoulder and knees.
I see. And one thing that I found so interesting about what you guys are doing at EVO is the pre-process to doing the stem cells, meaning the therapies that you guys are recommending before so that people have better results. Do you want to elaborate more on what your treatment plan is like at EVO?
Yes, definitely. Because stem cells, they're not a magic bullet. Inject some stem cells and the patient miraculously gets better. I think you should see it a little bit like when you have a garden and you're going to plant seeds. Yeah, you could take a handful of seeds and just kind of throw them in your weedy garden and hope that they grow, but the crop you're going to get is not really going to be very good. Yeah, if you're going to really want to harvest something good, you're going to prepare the ground, get rid of the weeds, make sure the soil's good. Yeah, and that's basically what we do at EVO with the human body. Yeah, so before we're going to give someone stem cells, there's always a pre-program that we try to do. So some of this might be just through taking nutritional supplements at home. Patients often stay a week or maybe 10 days with us, where we give them all different kinds of IVs because we know if the immune system's working or optimized, the result's going to be better. Or if we get the cellular terrain working nicely, so the cells, the ATP in the mitochondria is nicely charged and the detox pathways are flowing properly and the cells are well nourished, then if we add stem cells, of course, the result is going to be better. And we also know that there's with disease, there's always a kind of mind-body component there as well. And, that's something we like to sort out too.
Absolutely.
So we involve that too. So, there's lots of different things that we'll do at the same time. IVs, there's hyperbaric therapy, hyperbaric oxygen therapy, do some laser therapies. And all of this plays a role in optimizing someone before we give them a stem cell treatment.
I think that's so fantastic and so important for anybody listening to really understand how they work and the prep beforehand. It seems like it's very, very hand in hand, very important.
Yeah.
So people are not throwing away their money.
So it's before and after, right? So even, for example, for joints, if we treat someone's knees, or whether they're bilateral or unilateral knee, we go through a lot of ranges of motion. We go through a lot of strengthening. We strengthen the muscles around the knee that need to be strengthened. We stretch the ones that are tight. And so this all kind of helps to accumulate the final result of restoring function to joints, specific to joints. And equally with pathology, like Phil said, there's a lot of pre-work that goes in and there's a lot of post-work that goes in. Part of it is by the patient, part of it we're responsible for, but the patient definitely has a role to play in his own recovery or her own recovery.
Absolutely. I love that you brought up the mind because it's so important because the first place is the mind because the mind controls the body. So having a patient understand that's where it really starts.
Yeah, sure. Usually we'll sit down with the patient and explain, if you're in fight or flight mode, for example, that changes your whole body chemistry.
Cortisol.
Yeah? So lots of adrenaline. Adrenaline's not really a healing hormone. If you have adrenaline, it's about survival. So it kind of keeps you ticking over, but it doesn't really bother with anything else. Yeah, we need to get patients into what we call oxytocin state. Yeah, so we need to change that state. Yeah, that's when you heal. Yeah, and so that's where that mind body, even if it is just something simple as an injury or something. Often patients get into that adrenaline state because they can't function the way they're used to and they're frustrated and they get kind of caught up in that mill, and that's what we need to change as well.
You must see a lot of that in Los Angeles.
A lot.
Very much.
A lot.
Yeah.
I think
a lot.
In the world.
It's an epidemic.
But after the hundreds of patients that we've now seen and I've seen come through kind of the rehab department of EVO, the ones I would say who've done the best have been the ones who've had a plan after treatment. to kind of minimize their stress. As odd as it sounds to say, you know, I wouldn't have believed this if I didn't see it with my own eyes. But the people who recovered the most were the people who figured out a way to kind of release the toxic people in their life and the environment and just go in the state of peace. These people seem to do the best.
Yeah, because
Absolutely.
adrenaline speeds stuff up, right? And you can't really heal when you're running really fast, sprinting. And so therefore you got to reduce that adrenaline flow, so to speak, right?
Right.
And so calming the mind is what you guys kind of are focusing on.
That's right.
To allow the body to do its own healing. You give it the raw data, the raw materials, and then you're good to go. But I think that's true. Everybody in this world, well, I shouldn't say everybody, but a lot of people in this world today are high stress.
Yes.
And you guys are probably seeing a lot of that, right, at your clinic. So when they come in high stress, you need to reduce that down to give the raw materials a chance to do its healing, which I think is a huge integral part. I mean, I was in the stem cell world, as you guys know, for a long time, and I saw a lot of people just coming in thinking they're going to get a shot and they're going to be miraculously healed. And then they're upset and mad when they're like, hey, I spent all this money, it didn't work. Well, you're not doing your own stuff at home, man. You're just going and continuing on with your regimen, and that's not going to cut the mustard. Right. So I think that's an integral part. It's in my opinion anyway. I think it's just as important as getting the treatment itself.
It is. There's definitely a mental component to recovery.
For sure.
Yeah.
Absolutely.
We often explain, to patients, like if you have one of those bad days where your alarm clock goes off late or you don't hear it and you wake up late and then you don't have time for breakfast and then your car won't start and then there's traffic and you get to work late and you get to work in that state and a small problem happens, your reaction is just like... But if you have the perfect day where you wake up 20 minutes before your alarm and you get to do your yoga and you have a nice breakfast and you drive to work and there's no cars and you get there, that same problem happens. You're like, hey,
Yeah.
And
it's the same way that
to deal with it. Yeah.
Right. And it's the same way our body reacts to disease. The disease might be there, but your stress level depends on, do you react in a big overshooting way or do you kind of, can you manage it? And that's a really important factor.
I find meditation really changes that outcome. I'm a big fan of meditation, and like you said, your reaction is a lot different when you're in that calm space.
Yeah, in fact, studies have shown that when someone goes into a meditative state, the oxytocin levels rise, and oxytocin is the healing hormone. So these kind of healings that happen through that state, it's nothing spiritual that happens. It's simply a chemical change in the body that allows the healing to happen.
Yeah, absolutely. There's also studies that show that people that take supplements, the body seems to absorb the supplements, I think by 30% more people who meditate on a regular basis.
Oh, interesting.
Yeah, it's really fascinating. Yeah.
See, so if you do stem cells, you got to meditate. That's what we're saying here at the Healers.
Well, it is. It's mind, body, soul.
I mean, it's a recommendation, right, guys? I mean, that's why it's coming around.
Sure.
So you got to let science do its job. You got to let you guys do your techniques, but you also have to do your part at home too.
Yes, and every case is different. Every patient's different. This is, a lot of my patients come and say, well, my friend did such and such, and he responded in this way. And sometimes they do. Sometimes they respond better than the friend because, this is what physiology is, right? Modalities affect different people different ways. This is why one person can take one aspirin, feel nothing, but some people take 5 aspirins when they have a headache. And it kind of helps them, right? It's kind of the same philosophy as any modality, really.
And then it also goes into the belief system because, I've seen people be really negative about stem cells. And then they come into the office, they get no reaction at all. And you just, it's like, it's the placebo.
And that speaks to the power of the mind, right?
That's right.
So that speaks to the power of the mind. And I agree with this. You definitely can counteract, some forms of treatment. By just taking yourself out of the game before it even happens. Yeah.
What are some of the other positive side effects people have been experiencing from the stem cells that, the feedback you get? Patients say, I never expected to feel, that.
Well, what's been interesting working with Amin, we've been mainly focusing on patients with joint disorder. So, we do a knee injection or a back injection with the stem cells. But these patients are suddenly reporting, that their blood sugar is more stable if they have diabetes or that they lead a lot less thyroid hormone. So even from a local injection, they're seeing a very strong systemic effect.
Right.
And past that, fibromyalgia is one of these kind of catch-all. Everyone thinks they have fibromyalgia. Everyone's been diagnosed with fibromyalgia. there's very specific orthopedic tests to test for fibromyalgia, right? And the very few physicians, I think, even know what the exam is to test for it. You don't need the blood work, you don't need the x-rays, you don't need any of the stuff. And I had a true fibromyalgia patient, if you remember, Phil, and this was a friend's mom. And when I examined her about a year ago, she came in, and I spoke to her on the phone a few times, and you can tell as she's talking, she's in such excruciating pain that she could barely even get the words out. When she came in, she was literally in tears because she had to keep doing this, and then to stand, and then to lean on the wall, and then to lean on one side because she couldn't even sit in one position without being in excruciating pain. This lady, beautiful lady, spent, I think, a part of her like savings on this and said, this is all I have because otherwise it's not worth living. And, we customized a protocol for her, a treatment plan for her. And, I prayed to God because this is not also my friend's mom because I want her to feel better. And I followed up with her like a week after. She was like, I'm a little sore from the treatment, but I don't feel any worse, which is fine because it's only a week after. There's an inflammatory process that sometimes happens immediately, which is almost needed. About 3 months later, I walk into the lobby to give my receptionist an MRI form, and I see her sitting in the lobby. She was sitting on the couch, and I said hello, and I walked over there, and I gave her a hug, and I said, and I'm scared to even ask her, right? I said, how are you? How do you feel? And I said, how's your pain? And she goes, what pain? Oh. And this is somebody who's been dealing with chronic daily pain for you. Now is everyone going to have this response? Likely not, to be honest. But the fact that it has that potential paints a very good picture of what the power of the procedures that we can do.
Absolutely. That's an amazing story.
I'll never forget this. When she said, because my heart was pounding. I was just hoping she was going to sound 50% better. I wake up now with a little bit of pain, but she goes, what pain? She goes,
that's awesome.
Pain? Yeah.
Let me ask you guys this, because I think this is important. There's a lot of clinics doing stem cells.
Good question.
Especially chiro. Okay.
Yes.
What separates EVO Beverly Hills from the other people out there that are doing stem cells? I know this is a vanilla question,
but I think we both have a great answer.
And I would love to hear because
go ahead. Go ahead. You take this one. I'll follow up.
I think I'd like to say we do real stem cell therapy. Unfortunately, the market is saturated with people, doctors, practitioners. I'm going to say touting treatments, calling them stem cells when there's not. We have doctors that are doing PRP and calling them stem cell therapies, just because there's 1 or 2 stem cells floating around in that, labeling that. Or the use of amniotic fluid is becoming popular. Of course, there's a few stem cells in it, maybe, but you can't really call that stem cell therapy. So when we talk about a stem cell therapy, we are literally taking stem cells and we quantify them, we analyze them, we can give you a number, we can show you the picture that you're getting of the stem cells, So we're actually using stem cells, and that's kind of what sets us apart. Okay.
Because I know that, we know that there's dead cells inside when you start to look at them under a microscope, and I think people still count those. And, so for people that are out there trying to get stem cells, you got to go to a reputable place.
Definitely.
That will take pride in what they do, and they'll not be a charlatan, because there's a lot of those in the industry these days. And I mean, that's kind of why I got out of the industry. I just think there's a lot of greed, and I think there's a lot of people that are trying to pull a wool over your eyes. So, I commend you guys on the research that you're doing before you're actually, and you're doing your consultations and all that stuff. So that's important as well to.
The research is a huge part of it, right? Research is always a big part of medicine or healthcare. There's people selling PRP as stem cells. We recently ran into that with a few patients that we've spoken to. So yeah, you're right. I think it's very important to find out. There's no real way of knowing without just doing your own due diligence and speaking to the doctors, seeing the research, and people have a very good gut instinct of other people. I feel like people's auras, you just get a good idea if you go and speak eye to eye with the physician, go look at the office. Most of all, speak to other patients. The proof is in the pudding. I, as a chiropractor, very rarely advertise. I've never really advertised. I have an Instagram page, but having been blessed by, maybe just luck, but a good heart and knowledge and good hands, my practice has grown. I think just doing the right thing and knowing what to do and when not to do something becomes vital in treating anyone.
And I think you touched on a point to, excuse me, something that sets us apart. We say no.
Yeah.
We'll see patients that will say, no, we're not going to treat you, or we don't think you have. Go ahead.
Why would you turn someone away?
Well, I think, first of all, it's important that someone understands the treatment they're about to receive so their expectations are correct. Yeah? So
Okay.
if someone's expecting this miracle stem cell, just inject some stem cells and I'm going to be good. No, we won't do that. So we really need to understand the process. There's also patients that are not willing to submit to a process. Mm-hmm. Yeah, we're not like a pit stop where you just come in, get your shot, and you go back in your life. There's going to be things that have got to change in your life and things like And so if you see there's not that willingness to do that, then we prefer not to treat.
Or they're just not a candidate for it. For example, they have infrapatellar tendinitis. Mild, and their pain level is 8 out of 10 because their gait is improper, which can be addressed by other things like orthotics or maybe stretching a tendon or there's many. Sometimes there's alternatives to treatment that don't require stems, and we are honest with them. We say, listen, you might come in here twice and I can treat you myself. If it doesn't work, fine, we'll look into stems. But oftentimes that treatment works, and because they trust us now, they go and scream from the mountaintops, this is an honest clinic. And so we get their friends, their families, and bosses, and employees, and things like this.
I love that. What's the machine you have called that stretches your neck, which I love?
Good question.
It's called a noose.
Those are cheap, man, as far as I know. You only need a chair.
It's called a rear naked chokehold. The most spine injuries are a result of compression. Most injuries to joints, at least musculoskeletal injuries, fall under the umbrella of compressive neuropathies. Carpal tunnel is a compressive neuropathy, tarsal tunnel, sciatica, the classic one. Decompression of the spine becomes vital, actually, for a number of reasons. Not just to decompress and allow the nerves that are firing out from our spine that innervate our organs and our muscles to function correctly, but there's a process called imbibition, which means that it's the pulling and the letting go of the spine. The disc can actually absorb fluids and breathe, I'm assuming. That's right, back into the disc. And so, this is counteracting compression. We're compressing right now sitting here. So decompression, it's a decompression table is the answer to your question. And that's why it feels so good.
It's amazing. For anybody listening, you have to experience this. It's close to orgasmic.
Yeah. It's like a neck orgasm. Wow, when can I make my next appointment?
Sold. Your phone's going to be ringing off the hook.
Just text it. When's your next opening?
Okay, not quite, but close.
Put that on our website.
That's pretty funny. Well, I wanted to give you props, Philip, because I remember meeting you back in 2013, maybe. I met through a friend, and you were the only guy that was to give me my correct diagnosis on my duodenum. I don't know if you remember that, but I had a stomach issue, and I went in there, and you hooked me up to this extravagant machine.
Global.
I don't know what I forgot what it was, but it was like, I was loving it because it was pretty fancy. And then you were just like, told me what it was, and then I got a second opinion, and that's what it was. Which I don't know if I ever told you that.
No, you didn't.
Okay. So I'm thanking you now. Yeah.
Do you want to explain the machine to the people listening?
The magic machine.
The magic machine.
Well, it's a machine that we brought in from Germany. So our practitioners, some of them use that and offer that as just as like a complimentary service to patients. So it's called Global Diagnostics. It's definitely not like a magic diagnostic machine. Yeah, definitely not.
It's a tool.
It's a tool that we can use.
It's a guide.
And so basically 2 electrodes are attached to the patient's feet, ankles, and it runs a current through the body and can look at kind of changes in the electromagnetic frequencies and things like that. And we get lots of data from that. And from that data, you can extrapolate a little bit where there's maybe problems in the body, there's problems with detox, if there's congestion, all these things, and that helps you put together a diagnosis, basically.
Yeah, it's a fantastic machine. I had it done a while ago as well. So
can I add something to this?
Of course.
The key word here is diagnosis, and something I've learned, and something I remember studying as a student when I did my rotation at the Yale University Medical School. They run the VA, and I remember these professors would always drill into you: treatment's easy, diagnosis is the name of the game. this is what distinguishes, I think, a good physician from an okay physician, is the ability to diagnose. Because once you can diagnose, it's a lot easier to treat something than to blindly throw treatments out there. So really the key, and this is what I pride myself on, in EVO, is our ability to diagnose. I think between Phil and I, we can diagnose almost anything, and we can at least get a differential diagnosis that's close to. And so, I just want to kind of throw out there that, treatment's part of the game.
It's so important. And I know from my own health journey of misdiagnosis is so common, unfortunately.
Yes.
I can't tell you how many people are not diagnosed or misdiagnosed. So I think it's really important that you touched on that. It really sets you apart.
Sure.
For sure.
Patients are desperate to get better. So anything a doctor will throw out there, they're going to jump onto and be like, okay, this is it. I want to get better. And they don't get better. And then they do something else, another doctor's. It might be your GI tract. So they go see 3 other doctors and they get treatment and it's still not better. So, correct diagnosis, I think, is the real name of the game in medicine.
I think what helps there too, or one of the problems we see, is specialization in medicine. So, once you get into specialization, it's very good because it makes experts in specialty fields. But with that, you lose your grip or your view of the big picture. And that's the nice thing at EVO. We have doctors there in different modalities, and they can work together and come up with that. Yeah. Just as a simple example, if someone has arthritis, you think of joints, problems with the joints. So orthopedic surgeon looks at the joints, but arthritis has nothing to do with the joints. It's an autoimmune disease. Yeah. So it's more kind of in the hormone, that area. So that's where you need to bring in your expertise to be able to control the autoimmunity rather than just focus on, okay, there's joint damage. We need to replace that joint or do something with, And this is where EVO's good, because we have these different specialties working together, and they can work in that way and kind of see the big picture for a patient.
How many experts do you have there besides you two?
Dr. Reed. So we have,
and probably about 6 different
6 or 7.
Awesome.
Different
Better than 2.
specialties.
You can tell they're all our best friends, and we know their names.
They're going to be like, hey, you guys had a blank stare when I asked who the doctors are. What's up with that?
I'll tell you, once they kind of enter, and between me and Phil, we usually have, because we get their blood work, we have x-rays, MRIs, and we collect as much data as we can possibly collect.
Got it.
And we kind of sit down. If it takes hours, it takes hours. We kind of go over everything, and between us two, it's kind of not that difficult, right? Because his field of expertise is not mine, and mine is not his, but they complement each other very well, and it pretty much covers the whole human body.
Awesome.
So I have a great role too, because I don't see patients. I don't practice at EVO, but I'm kind of in the background. Yeah, so I can communicate between the doctors, and I can give some of my expertise to the doctors as well. And together we can really, evaluate,
right.
come up with
That's
a complete
awesome.
picture.
Yeah.
That's amazing. So basically, people are seeing a team of experts, a team of people.
Yeah, we have great resources. We have an orthopedic surgeon who specializes in extremities, who, was the former surgeon for the Raiders. We have these people kind of at our disposal, and if and when need be, we call upon them if it's something that requires their knowledge.
I see. And I'm just so curious, do you see a lot of people that are misdiagnosed come in?
Many.
Yeah.
Yes.
Yeah.
Mm-hmm.
It's unfortunate. Yeah.
Unfortunately, too, a lot of them have their internet diagnosis.
Yeah.
From reading, they come in and they're like, I think I have.
Yes.
Yeah.
Yes.
Wow,
Am I going to lose my arm? Yeah, I get this.
That's actually a huge gold nugget for today, besides the diagnosis part. But that's so big because everybody's looking on the internet.
And anyone could write anything on the internet. And most people don't understand this. They think because it's written there, they're going to lose their neck because they have a headache.
Yeah,
it's true.
That's true. And we saw this actually happen in kind of a patient group. There was a Facebook group. We know we've treated maybe 1,000 patients, and then you'll see a patient make a comment in a Facebook group and say, oh, well, I did this and I did stem cells and this happened to me. Yeah. And then 5 other people say, oh, that happened to me too. So because 5 have said it, then it must be true. Yeah. There's another 995 out there.
It didn't have that.
Of course.
Right.
5 in the group have said it, and then that becomes fact, and then that kind of gets passed on.
And there's the magic sugar pill.
That's right.
Yes.
That's right. I mean,
Right.
the people who've gotten better, God bless them, have moved on and aren't looking back, and I don't blame them.
Yeah.
They've spent years in pain and suffering. In every facet of treatment, in any facet of medicine, Some people get better, some people don't. It's just the way it is. Even in dentistry is the way it is. This is kind of the part of the whole circular game that you play when you get treated. You risk not getting significantly better. That's usually the vast minority, but that minority is very vocal.
Yeah,
right.
Of course,
the majority who've recovered are gone. They're gone, enjoying their lives, and so I think any practitioner has to deal with this.
Yeah, you're so any kind of negativity you're going to get from the minority,
of course,
right? And there's going to probably be a lot of them in comparison to. I mean, you've got thousands of patients and you have a minority, but it seems like there's a lot of people that are complaining.
It's a louder minority, so much.
Yeah, and I've seen it. I've been in the medical field for a long time, so I totally concur with you guys on that aspect right there. That's a big issue, obviously, for you guys battling that for your ratings, because everything's all ratings now. It's like, how's your opinion? How are the ratings?
Fortunately, what we don't have that maybe some other physicians have is that we don't have a significant number of people who've gotten worse or have had no change at all. Most people get better. A portion of those people recover. A portion of those people get significantly better, but rarely, if not one or two, I can't remember anybody who has had no change whatsoever, with the exception of 2% out of all these patients.
Yeah.
Wow.
And usually there's a reason for that too when you look
Correct.
into it.
Yeah, that's a good point. That's a good point too. Yeah, there's actually many reasons that are beyond our control sometimes.
Right. The person doesn't really want to get better.
Or,
you always have that person.
Lifestyle, a lot of times they expect they can just keep eating and doing the same things they're doing and recover.
Yeah.
It's just not the case.
Yeah. So we're talking with Philip and Amin from EVO Beverly Hills. And, guys, when you go on Amazon and you buy a book, right, do you guys look at the negative reviews as well as the positive? Or?
I do.
Yeah. So I'm asking that question because if people were to go on it and just focus on the positive, I mean, unless you got all 95% negative, then you would skip that book, right? But when you have a lot of positive reviews, and which I'm assuming you guys have more positive reviews than negative.
Yes, of course.
Why would you not want to focus on the positive and then expose that to your clientele? And then and again, it's a matter of choice.
But it's a great point. You asked the question whether you look at the negative. I look at the ratio. I look at the ratio of positive to negative. That's the first thing I look at, right? Mm-hmm. And if I see, like you said, if it's 89 to 11, it's fine. I believe it's a good product. If it's 50-50, I'll read the reviews, and I still may opt for the book.
Yeah.
But if it's obviously reversed, then I have my doubts, and I usually move on. But it's a good question.
But I think too, it's kind of dangerous to look at medicine in that way. Yeah, a book is a book. There's a matter of taste. If you like the book, if you don't like the book, But then you can put, let's say, there's a scientific evaluation. Is it well written? Is the grammar correct and things like that? You can do. With medicine, what you could evaluate is maybe the way the doctor is, his approach to the patient, his friendliness, his aftercare, those things. Yeah. But when it actually comes to treatment, it's such an individual thing. It's something that the patient brings with them, the situation that the doctor's now got, who uses expertise to unwind. Yeah. Mm-hmm. And that is for one single person. Every single person is different. So if you're basing your choice on reviews in that way, I think that's the wrong way. Really, you've got to educate yourself as a patient to understand, what is my disease? What are the challenges there? Yeah. And you've got to look at it that way. You can't really base it on what everybody else did. Do you know
I just think that's a starting point for people. You know what I mean? I agree with you. It's individual, but I think a lot of people are focusing on.
It's a reference,
right? Because that's why Yelp became so big. Because,
it's an unfortunate reference, but
it is an unfortunate reference. Yeah, but that's what I meant by that. Not using the book as an analogy. Product review. Period. For sure. No, absolutely.
Because we often say medicine is an art. Yeah, it's not a science. Everyone thinks it's a science. It's not. Mathematics is a science. You always get the same outcome if you do the same thing. Chemistry, a science. Yeah, there wouldn't be good and bad doctors if medicine was a science. Yeah, it would be basically you have a disease and you do this equation. This is how you fix it. That's a science. Yeah. But now you're relying on this artist to come in and kind of use his intuition and use his skill and do something and create something from it. Yeah. it's an art. So the outcome is always going to be different every time you do something.
Is that a quote? You're going to coin that, or someone already quoted that one?
I already coined it.
You already coined it? Because I like it.
Yeah.
I'm all about the quotes, man. We are. We're me and Gabby like the quotes.
You guys are the best.
We do a lot of quotes, man. I love that one. That one's going to get splashed on the screen, I can tell you that. Medicine is an art.
Yeah.
I never looked at it that way.
I'd say research is a science. Medicine is an art.
Absolutely.
There's definitely an element of art to, especially to, for example, for what I do, imagine, right? I have to feel and paint the image of what I'm actually feeling to be able to correct it. And then it goes to the correction, right? The pressure, the sensitivity. I mean, you're touching human beings more than probably any other physician in America. And there's a definite art to this because everyone has a different tolerance. Everyone has a different pain level. Some people aren't verbal. You ask a lot of patients, on a scale of 1 to 10, how bad is your pain? 0 to 10, they'll be like, it's bad.
Or a favorite answer is 20, and you're like,
yeah. It's true. It's true. Even on the intake, sometimes they'll just mark like 20. They'll go way beyond the borders, which you kind of refer them.
That's funny.
Yeah.
I bet it's interesting. You see and hear a lot of very exaggerated.
Oh yeah. Pain is subjective.
Very much.
But
It is.
But you can't disvalidate anyone's pain, right? It's pain. But as a physician, you have to make the decision whether the pain meets the pathology, right? The disorder. So you do this by orthopedic exams. You do this by, we have orthopedic exams that can test if someone's fibbing about their pain or about the anatomical side of injury. So there's many ways to do this, but pain is real. I always consider every patient's pain to be real unless I have reason to prove otherwise. I never doubt people's pain.
So you guys have a lot of patients. What is your primary patient coming in for stem cells? What would be, do you guys have like a top tier of, would it be like ligament pain, tendon pain, shoulder pain, back pain? What would you say is your higher percentage of people coming in for stem cells?
Probably
asking for them.
I would say, I personally, from what I've seen, I would probably say neck and knees.
Neck and knees.
I would say neck and knees are the two most, and then you of course have your low back. Yeah, you have your we got a lot of wrist, pain. We got a lot of headache patients. Right.
Yeah, I'd say
I would think from people
Yeah.
being on their phones and computers
That's
so
right.
much now, and especially people hold their phones here.
That's a great call right there.
What is the name of that? Because
Text neck.
Text
is the
neck.
actual
Text
is the
neck.
actual name that they're coming
they
out
actually
with.
really.
And it was I think the statistic, and don't quote me on this, was something like there's been this 250% increase in cervical spine injuries due to technology,
I
not
believe
just
it.
the phone, but taking a
computer.
picture, looking down, the computer, people laying on their beds, putting their laptop on their stomach and doing this and flexing their chin forward.
Even just sleeping on a pillow, right?
The wrong pillow, sleeping face down with your neck rotated, which a lot of people do.
worst.
I mean, there's many ergonomic facts and advice that we can help a lot of people with, Phil and I, and maybe that'll be a later show. But there's many subtle things people can do to significantly increase and better their lives.
And do you think the risk increase is from texting
Yes.
and computer?
Yes, 100%. The computer wave started these wrist injuries because people were just neither hyperextending or hyperflexing their wrist, mostly hyperflexing, which is where kind of carpal tunnel started. And now texting, cell phones, right? Everyone has this like little strap on the back where they're tweaking their wrist and they're holding it there and they're using their thumb and they're straining their thumb. And what you don't realize is how often you're actually doing this. So, I've seen a lot of wrist, thumb injuries now. I see 60% neck injuries. We see a lot. Vision problems. People are having a lot of vision headaches from looking at this bright screen all day.
Right.
So, it's
Logan is on the computer
Too
quite
much.
a bit, and he experiences a lot of those
Well, I
symptoms.
told you I have a
Yeah.
spondylosis of
Yeah.
the cervical C5.
I mean, fortunately, the guy's built like a machine, but
Yeah, he's a warrior.
This machine's breaking though, bro. Not when I was 10, 20 years ago, man. Hey, that's what age
Of course,
does. You just
of
start
course.
to decay. And
of course.
You know,
course.
so
That's where stem cells come in.
True, that is true. That is true. Stem
Are you
cells
seeing
definitely
the
work.
stem cells are benefiting people with those type of issues?
Oh
with
yeah,
the
so
neck and the wrist?
I'll give you a real life example. I saw a kid. I mean, I don't know, he was like 26 years old. He was in his car accident. The car behind him, he had a severe case of whiplash. This guy's pain for his neck after conservative care treatment was still like an 8 out of 10 after 2 months of care, coming in coming in twice every week. And we did a stem cell procedure on him. About 3 weeks later, maybe a month later, he came back and he said, my pain is about a 1 out of 10.
Wow.
Sometimes a 2 out of 10. And that was, several months ago. And today his pain is still at a 1 or a 2.
That's amazing. And one quick question about how long from the time somebody has the actual stem cells injected, how long do they start feeling and seeing the results from it? How long does it take to really?
I think it varies, but Phil can address this better.
Yeah.
It does vary from patient to patient. So with some patients, we'll see an almost immediate effect. In fact, when we put in stem cells, they're very highly anti-inflammatory. So you often see kind of an immediate, I feel so much better. Yeah, It doesn't last because it's just that moment. Yeah. So typically after that, they might have a week or two where a joint is very stiff because the cells that we put in there, they kind of puff up and they take up space and things like that. So, but we tell patients you need to stay active. Yeah. So this isn't a matter of, go home, keep your leg up. You need to become active because stem cells like the stress. Yeah. Typically, we'll see 3 or 4 weeks after the treatment, pain levels start to kind of go down, and then 6 to 12 weeks afterwards, patients seem to be doing pretty well.
Yeah, and again, it varies. Some patients are not feeling any sort of improvement for like 3-4 months, but then they suddenly start to feel a significant improvement. So there's no, the best thing to do is to not dream, but to just do the best you can to put yourself in a healthy environment post treatment. It's the best thing you can do for yourself.
Do you guys find that people are coming in dehydrated when they come in for these treatments? Do you think that that's the case?
I don't know. I don't know.
Yes, I definitely think so. Yeah, and that's why we like to use IVs and things. And some of our IVs is just simply hydration. Yeah, giving lactated ringers disease, lactated ringers, just to hydrate and put electrolytes back in. That can make a big difference.
Yeah. Well, I mean, blood's made of water, and stem cells float in blood, so that makes sense, right? I know. I just found a big bloat in that area when I was doing it. Was dehydration. That's why I'm just asking you guys.
Sure.
Yeah.
We see that. Yeah.
You guys see that a lot.
Awesome. I don't. I myself am dehydrated all the time, so it makes complete sense to me.
That's because you're always so busy.
I am. I am constantly dripping. I drip sweat all day some days, but it's rewarding.
I'm going to start reminding you every time I see you.
Please do. Text me.
I'll be your water police.
Please.
Yeah. Interestingly, we're seeing a larger patient group or a growing patient group coming with traumatic brain injury, so TBI.
Wow.
Yeah. So especially people who are involved in sports have TBI. And we're seeing great success. There are some interesting studies that are slowly developing the use of stromal vascular fraction or fat-derived stem cells in combination with hyperbaric oxygen therapy.
Okay.
And these are things that we've now started to use, and we're also seeing very good results with that.
I'm assuming you're doing IV with the stem cells. Systemic, right?
Systemic, yeah.
Yeah, hyperbaric. Car accidents.
Hyperbaric.
A lot of whiplash, coup injuries,
Yeah.
People's kind of significant whiplash patients, they're starting to kind of recover their thought and their memory, and it's really fascinating.
I know this is a basic. Is insurance covering any of this stuff now for like car accidents and stuff?
It all varies. It all varies.
It really varies.
It all varies. Because
I know that's a big question.
Not for the stem cells. Not for the stem cells. But some of the hyperbaric treatments sometimes, but not for the stem cells yet. But my prediction is that this will replace the current faulted system of epidurals and cortisone shots, because these are just Band-Aids. What is an epidural really doing to the guy who has a 5 millimeter?
Buys you some time of pain, baby. That's it.
But there's a bigger problem than that. And the problem is that once you feel better, these guys are going, okay, great, I feel great. I'm going back to the gym. I'm going to play ball. I'm going to pick up my son. I'm going to wrestle, whatever it may be. And when the injection wears off, you're now in the worst state than you were when you got the injection. And so it's actually much more harmful than just the Band-Aid.
And that's where it goes into what you said, the diagnosis part and the consultation, and where you guys' professionalism and your knowledge comes in to tell them, hey,
treating the root.
The root cause. I'm all about origins.
Getting to the root.
For sure.
Absolutely.
Yeah. So we're almost out of time, but I mean, Gabby, you have any more questions for these fine gentlemen?
It was so amazing. I mean, I think that's pretty good. Yeah.
I think we got a good start.
Yeah.
I think you guys have a fantastic show. And for anyone listening, I just want to know that these two truly have dedicated themselves to helping others. And every time we've spoken to them before this actual podcast, they've all they say is all we care about is that someone benefits from this show. So tune in, please.
It's putting you guys on the pedestal. That's it, man.
This is true.
So how can people find you? You're on social media, direct access with your phone number. You guys want to give that? I'm going to splash it on the screen anyway. But
well, his phone number is no.
Everyone has it anyway.
Right, that's true. Yeah. So EVO Beverly Hills or EVO's -BH.com is the website.
evo-bh.com.
Yeah. Mm-hmm.
Okay, we'll make sure we splash it up on the screen.
Sure, appreciate it.
Yeah, and then your phone number, and people can get a hold of you that way.
Sure.
Awesome.
Thank you so
guys,
much for all you guys do in helping heal people, because there's so many people out there that don't have the heart integrity you guys have.
Thank you.
Thank you for creating the awareness.
Yeah.
That's important.
Yeah.
Thank you guys for coming.
I was just real quickly. I was going to start my own podcast. I bought one little camera and a little microphone that was like up to here, and now I'm seeing with this setup that these people have. I'm about to return it back to eBay.
There you go.
You're always welcome to come here.
You're very sweet.
Yeah.
Thank you so much.
I want to just give you guys kudos. I think what makes you guys stand out is your passion for this business.
Yeah.
In the medical field, like you said, Philip, medicine is an art. And I love that. And I think that is, that's what sets you apart. I mean, I know, from the small time we've shared, I can just tell, and of course I run your numbers, but I know what kind of person you are, and I know your passion.
I love it.
To this
I live
industry.
it. I breathe it. I love it.
Yeah, man. And that's the people that we want to attract and really put up on the pedestal. Is not just somebody that has a practice that wants to make money. You guys actually want to really help people get to the level of, experiencing life on a high level again.
As do you.
So absolutely, man.
Yeah,
that's what we're all about.
Feeling good.
Yes.
Yeah, absolutely.
Yes.
Yeah.
Thank you for having us on.
You're very welcome, guys.
So much,
We'd love to have you on again. So that's it for this episode of The Healers. My name's Logan, the lovely Gabrielle. For Philip Badiade and Amin, what's your last name?
Javid, Javid.
Javid. Okay, and for Amin Javid, this is The Healers. We've been representing EVO Beverly Hills. Until next time, everybody, that's a wrap. Good night.
Good night.